Now, you're a patient of mine, I'm Dr. William O'Connor, and you had a lot of stress in your life not
Yes.
too long ago.
Yes.
And you came to me, and let's see, did you have high blood pressure as well?
No. No.
Just stress.
Yeah.
And describe what that stress was doing to you and how it was ultimately making you miserable.
Well, my life has always been, never really felt that happy spot. It was
Uh-huh.
always just under the radar, very kind of depressed, and then when the stress comes along, it would drive it even lower, take me right down, and I'd have that kind of fight routine feeling, and
I call that a fight or flight trill. It's like an ascending sensation that
Right.
actually you can physically feel the change in your abdomen and your down near your
butterflies
in
go
men
more.
it can give a genitalia like a tingle.
Yeah.
And you feel this ascending tingle that moves up, and it can come from things such as like picking up a letter with a lawyer's address on it,
Yeah.
or thinking about some bad event that could happen if you don't intervene.
Right. Yeah.
And you were having a lot of those, right?
Yes, all the time.
And
yeah.
you couldn't sleep.
Very well, no.
You couldn't get to sleep, and were you waking up early in the morning,
I
or
wake
waking
up early in the morning, feeling very depressed.
right? And
And
so that you didn't even want to get out of bed.
didn't want to get out of bed. Why get out of bed? There's
Right.
no sense.
Right.
There's nothing, let's take a short walk off, a long walk off a short pier. Let's just get it done.
And I gave you a drug that you put under your tongue at night,
Yeah.
a half of the smallest dose,
Yeah.
and you noticed that now you could sleep, and now you could describe that, what it did.
Well, like you don't even notice it. All of a sudden, it's not like a high. You just feel kind of normal again. It's like
Right.
a normal feeling again. It slowly comes in, so you don't even realize it's happened.
Right.
And in the morning when I wake up, I now feel like, okay, I still wonder what life's about, but let's just get up and get going, and you're not depressed anymore.
Now, that component of it was I had you break in half a sample of a different medicine.
Yeah.
That you took in the morning.
Right.
Now, when I told you to put it at the bedside and have it already broken so that when you are in that frame of mind that you don't want to get out of bed, you just simply pick it up and put it under your tongue and
Yeah.
let it dissolve. And then within, about a half an hour, what happened?
Exactly, just about a half hour. And you don't, like I said, you're sitting there and you just feel this, and all of a sudden you go, okay, I'll get up, and pretty soon I'm like, wait a minute, things are good.
Right.
I mean, nothing's perfect, but
Right.
it's good.
So it was almost an immediate, instantaneous
Yeah.
relief of the depression.
Right, half hour, that describes it.
Yeah.
An hour later, you feel a little
Right.
better.
You aren't like you would have been in the absence of it. And it's an extremely small amount of medicine.
Yeah.
And so you're a beneficiary of something that I've been doing that isn't in the medical literature.
Right.
The one use of that old blood pressure medicine at night to stop the trills and the fight or flight responses,
Mhm.
and the other one to get you out of the depression that having all of those explosions of neurotransmitter depleted your neurotransmitters.
Right.
And so it's pretty much transformed your ability to enjoy life again, doesn't it? I mean, you're
It
not
does. You can
miserable.
now enjoy, yes.
Yeah.
The things I like to do, much more enjoyable.
And-
That's not your focus is now on, oh, this is what I enjoy doing, and not fighting with the depression feeling.
And those trills that we talked about, I call them the fight or flight trills.
Mhm.
Those went away, right? You don't have those anymore, do you?
No, I don't. No.
And it's just kind of like magically they disappeared. They aren't coming
When
anymore.
they first started, it was still there, and then they started disappearing, and they're fading right down,
Right.
almost to nothing. You could feel them, which is a normal feeling in life anyway.
Right. Right. Well, they don't completely delete them
Right.
because you need a fight or flight response.
Yeah.
If a bear's scratching at your door.
Yep.
So it won't completely turn you laid
No.
back, say, oh, bear gonna eat me? Ah, well, I can get over that.
Yeah.
No, you still get it, but the threshold at which you get those has
Yeah.
been raised to the point where little things don't set that off.
Oh, yeah.
That's the key.
Yeah, you stop that, you say, okay, this is just, you feel it, you go, oh, that's just something small, I just go on.
Right.
I agree, that's just about what's happening.
Yeah, well, that's like I say, a unique offering that I invented basically by using my intellect instead of data-driven antihypertensive therapy. Because a lot of people have stress-induced hypertension, and it's not the same as a person who is overweight, obese, diabetic, who's retaining salt. You know, that's a different depression. But conventional medicine treats all depressions as a singular disease.
Right.
And it isn't. Your depression, I call hyperadrenergic or catecholamine induced, which is the fight or flight chemical, the adrenaline. And it's toxic. It's toxic if you continually are exposed to it. It's designed for occasional use only. And yet people in the 21st century have it every minute when they watch TV, when they pick up their mail, when they get a phone call at 9:30. Oh my God, what's got, you know, somebody's, and watching TV. I mean, now that will give you a fight or flight response. So all of that has, as from your perspective, has gone away. Is that correct,
Correct, yeah.
assessment?
Yeah.
Cool. And you don't mind if I use this to advertise my website or my
None
capabilities or as a doctor? Okay, good.